Hi, Hannah. I'm here to do your cranial nerve assessment. How are you today?
Good, how are you?
Okay, good. And what I'm going to start with is the olfactory nerve, cranial nerve 1, and this tests your sense of smell. So what I'm going to have you do is close your eyes and occlude one nostril, and I'm going to have you identify this smell. Can you tell me what that is?
Vanilla.
Okay, vanilla, excellent. Now I'm going to present another scent. If you can occlude the opposite nostril and identify this scent for me.
Cinnamon.
All right, excellent. The next cranial nerve that I'm going to test is cranial nerve 2, the optic nerve. And what I'm going to do, Hannah, is show you a picture of the Snellen chart, and I'd like you to read the smallest line you can read.
CESPOTEC.
All right, excellent job. The next cranial nerves that we're going to test are cranial nerves 3, 4, and 6, the oculomotor, the trochlear, and the abducens. And we test these cranial nerves together because they all work together to control voluntary eye movement. So what I'm going to have you do, Hannah, is follow the tip of my pen light, all right? And I'm going to watch your eyes as you follow my pen light. We're going to go up and then back to center, over, and then back to center, and down, and back to center. And then we're going to do the same thing on the other side, up, as we're doing the 6 cardinal positions of gaze. And what we're looking for there is smooth eyeball movement, all right? We're also looking for nystagmus, which is a fine, rapid jerking movement of the eye when the pen light is toward the outermost point. That would be an abnormal assessment. And the next part of that 3, 4, and 6 cranial nerve assessment is a pupillary assessment. So, Hannah, what I'm going to have you do is just look at me at first, and we're going to check the pupil size without the light in the eyes. And it looks like your pupils are about 2 to 3 millimeters, probably about a 3 millimeters. All right, excellent. And what I'm going to do is have you look at my nose while I shine a light in your eye. Okay, you ready? All right, I'm coming in from the side and going back out. And what I see there is that the pupil on the side that I shine the light to is constricting. What I'm going to do now is shine my light into the same eye and look for a consensual constriction in the opposite eye. So Hannah, look at my nose again. All right, and I see that consensual constriction. All right, I'm going to do the same thing from this side. Shine the light in. All right, and it's constricting. I'm going to do the same thing again, looking for a consensual constriction in the opposite eye. All right. I'm also looking to make sure that the pupils are round and that they do react equally. Another thing that I would look for if I notice that there was a problem in my pupillary assessment is something called accommodation. And I'm going to assess accommodation by having you gaze at a distant point on the wall and then gaze at the tip of my pen light. All right, now look back at the pen light. Excellent. And the pupil should constrict as that vision changes from far to near. Cranial nerve 5 is the trigeminal nerve. And Hannah, to assess this cranial nerve, what I'm going to ask you to do is close your eyes, and I'm going to touch your face in different places with a cotton ball. If you can just let me know when you feel me touch you and where I'm touching you.
I feel you on the left cheek.
Okay, left cheek.
Left cheek. Chin. Right cheek. Left cheek.
All right, excellent. All right, cranial nerve 7 is the facial nerve. And what I'm going to look for here while I assess Hannah is facial symmetry. So Hannah, if you could smile for me, all right, and if you can frown, close your eyes as tight as you can, all right, And puff out your cheeks. All right, and all the muscles on the face are symmetrical, so Hannah's looking good in the facial nerve department. Another thing that we would test with the facial nerve is taste to the anterior 2/3 of the tongue, but we're not going to do that today. And Hannah, I'm going to test cranial nerve 8, the acoustic nerve. What I'm going to do is whisper some words to you, and I want you to repeat those to me. Okay? So,
Please.
all right, and the opposite ear.
Hot dog.
Okay. Another way we can test cranial nerve 8, the acoustic nerve, is by activating a tuning fork and putting the vibrating tuning fork on the top of Hannah's head. And she should be able to hear that vibration bilaterally and equally in each ear. Hannah, do you hear the vibration equally? Yes. All right, excellent. Okay. Cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve, are again tested together as they work together. Hannah, what I'm going to have you do is open your mouth and say ah. All right, and what I'm looking for there is that the soft palate rises symmetrically, and Hannah's does. Another way to test those cranial nerves is by the gag reflex, and I'm not going to do that to you, Hannah, today. All right. Cranial nerve 11 is the spinal accessory nerve, and Hannah, I'm going to ask you to sit up so that I can test this cranial nerve. What I'm going to ask you to do is shrug your shoulders against my gentle resistance. All right, excellent. And those shoulders do rise symmetrically. The next thing I'm going to ask you to do is turn your head to the right against my gentle resistance. Excellent. And to the left against my gentle resistance. Okay, excellent. You can lay back down. And cranial nerve 12, the hypoglossal nerve, is the last cranial nerve that we're going to test. And Hannah, what I'm going to ask you to do is stick your tongue out. And what I'm looking for is that her tongue is midline, and Hannah's, yours is. So thank you so much for participating in my cranial nerve assessment.